Nurses care for the whole patient, mind, body, and spirit. Today, we're going to talk about the spiritual aspect of nursing care. This spiritual aspect of nursing care not only benefits our patients, but it keeps us focused on the why of nursing, and it allows us to prevent burnout and allows us to address our own hearts and making sure that we are being true to ourselves and recognizing our own mind, body, spirit connection as we do provide human care. Human care is going to involve spiritual care. Today we'll be learning from Giddens chapter 5, Davis chapter 16. You're going to want to complete your concept study guide and then list and describe the 5 major world religions and answer the following questions. So as always, please go ahead and pause here, take a screenshot or write these down in your notebook so that you'll take notes on these objectives as we go. So spirituality is hard to define. It's unique to everyone and represents a very personal experience. And so there's not really a universal definition that exists. But the quality of life, the meaning of life, its purpose, the sense of wholeness and connected are all affected by spirituality. So what's the difference between spirituality and religion? Because oftentimes those seem to go hand in hand or even get confused with each other. So religion is a map that outlines essential beliefs, values, and codes of conduct into a manner of living. And it's sort of like a culture where that it's a taught set of beliefs and passed down from generations and taught to others. And many of the world's religions do hold common beliefs. Spirituality, on the other hand, is a journey that takes place over time, and it involves the accumulation of life experiences and understanding, and it's an attempt to find meaning, value, and purpose in life, just like religion does, but without that set construct of an official religion. The scope can be broad and complex, encompassing life itself and the meaning of life for each individual. And the continuum for this concept is from spiritual well-being to spiritual distress. And oftentimes it seems that in times of crisis, like an illness of an individual or a family member, that's really when we see the spiritual distress of a patient or a family member. And this is why I said there's that mind, body, spirit connection, and human care is spiritual care, because we are seeing people often in times of spiritual despair because of the illness or crisis that they're facing. So we need to feel equipped to manage not only their IV, not only giving them a medication, but helping them navigate this spiritual distress, which sometimes can be almost more intimidating than passing a med or starting an IV. Because we don't always we always have those tools. It's not as tangible to do that. So I hope you come away today with some tangible tools to allow you to freely and graciously provide spiritual care to your patients as well. So spirituality is very universal, but it's also very individual. And so patients or family members must be willing to share and act on spiritual beliefs. And spiritual beliefs and practices are certainly impacted by the family and their cultural background. And illness can impact spirituality, often leading to spiritual despair, but sometimes elevating a person's sense of spirituality and their place in the universe. So nurses need to be able to assess and integrate patient beliefs into the care they provide. Then they also need to know what other resources are available to the patients. So there's going to be different spiritual experts, often called chaplains in a hospital type setting. And there are other community-based religious organizations that can provide support and resources as well. So again, nurses are the care coordinators. And so we need to know all the different resources we have available to us so that we can coordinate care appropriately for our patient, even as it comes to spirituality. So how are spirituality and health connected? So it's interesting, some research actually suggests that religion has a positive influence over both physical and mental health. So there really is some kind of connection between the mind and the body and the spirit. But research doesn't always answer the how or the why religion affects health. We just know that it does. So we know that our patients are going to be experiencing spiritual distress, as they come to us with illnesses and often life crises. And we know that we need to be able to provide and navigate basic spiritual support for our patients. In order to do that, we have to have knowledge of certain religious backgrounds in order to understand where they're coming from if they ascribe to a religion. And probably the best way to do that is to have a basic understanding of the 5 major world religions. And then if a patient presents with a different religion, you can always look that one up later. So one of the objectives of this training is to list and describe the 5 major world religions. Now you can do that one of a couple different ways. There's details in your Davis text, page 323 to 328. So if you like to read, just go ahead and just go right to that text, pause this video, read that, and that will give you a basic understanding of the major world religions. But if you'd rather just listen to a video, I put a 5-minute YouTube video, a crash course to world religions, that'll give you a basic understanding. And it will be important that you know these world religions as it comes to testing for this course. So again, let's talk about barriers. Why don't nurses always provide excellent nursing care when it comes to spiritual nursing care? There's a couple of barriers that your text discussed. A lack of awareness of spirituality in general. Maybe it's just not something that you've really thought a lot about in your life. And so the fact that it's extremely important to someone else may be very different for you. Or a lack of awareness of your own spiritual belief system. Again, just like we talked about with health promotion and culture, having a sense of our own self-awareness makes a difference in how we care for others. Trying to be things to all people. And so sometimes we're not always the expert at this. And so knowing what our resources are to be able to provide patients other options. Differences in the spirituality between the nurse and the client. So if you're someone who has a strong religious belief and your client has a very different religious belief, you can find that to be something difficult to navigate for some, to be able to provide spiritual care to someone of a different belief system. Fear that your knowledge base is insufficient. So sometimes if we feel like we're not a religious leader, and so how can we provide spiritual care to someone? We're an expert in nursing, but maybe not in religion. And so sometimes just wondering if your knowledge or your ability to provide spiritual care is going to be enough for that patient. And I'll tell you, many times it is, because sometimes you're the person who that patient sees the most. And so just having someone who's listening and being present with them makes you the person that they need at that moment. And then finally, the fear of where spiritual discussions may lead. It may be somewhere that you just don't want to go in your own heart, or that you feel inadequate if the patient continues down this discussion. So those are some barriers to spiritual care. I encourage you to kind of get a gauge for where you're at with this. So the reality is some patient you're going to have at some point, and probably not in the too far distant future, is going to have some kind of spiritual discussion with you, or ask you to pray with them, or talk about their religion and how that shapes their own health beliefs. And so being able to kind of get comfortable with this and grapple with some of these barriers and where you're at with this will make that not a surprising situation. As always, we need to know how to assess for this. So how do we perform a spiritual assessment? I think your Giddens text provides a really easy, straightforward spiritual assessment tool. It's called FICA, F-I-C-A. What's their faith or belief system? What importance or influence does it have on their life? Some people, it is the center of whatever they think and believe. And some people, it's just something they do on maybe, Easter and Christmas. So the importance or influence in their life. What does it mean for their community? Are they part of a spiritual community? Do they attend a specific religious services? And what role does that community play in their life? And the final is the address. In other words, how would you like me to address that in terms of your healthcare today? What kind of influence did you want that to have on the way that I treat you today? So what are some nursing interventions for spirituality? Honor the family or patient's religious beliefs, making sure that we acknowledge that and honor whatever those beliefs are. Refer them to a chaplain. They are the expert in the healthcare system and can help navigate some of those more spiritual discussions. Provide you religious literature. Some patients or family members might find that very comforting or useful. And then finally, practice presence. And I put that one up on the screen today because I feel like presence is something that we can all do no matter where we are at with our own spirituality or religion, or how comfortable or uncomfortable that makes us feel, but we can offer our presence to our patients. And that not only helps our patients, but it helps us. It helps provide that meaning to what we do. It helps us be mindful in the moment of where we're at and what we're doing. And it also feeds our soul to be practicing presence with our patients. So that's probably the best takeaway off of this list. When I was in nursing school at Morton College, I went to a Dr. Jean Watson nursing conference that was held in Oak Brook for a few days. And it was about the art and science of caring. And it was all about how we provide care for our patients, not only for our patients, but for ourselves. And when Dr. Watson started the general session, there were probably 500 people in the room. And she started by ringing these gongs, or some kind of bowl or something. She was ringing bowls. And I was sitting in that room and I was like, we are in a professional conference and we're ringing gongs. Like, it was very strange to me. But the more she talked about her methods and what she does and connecting her own spirituality to the care that she provides, and then how that feeds her soul and continues to reinvigorate her and prepare her for the next patient, I kind of got it. It made more sense. And not only did it help me provide care of the whole person, mind, body, and soul, to all my patients, but it also fed me and continues to drive me so that I don't burn out in nursing as well. So again, the interrelated concepts from your Giddens, how spirituality interplays so much with how people cope with stress or in their family dynamics, how their culture and spirituality are often integrated. And even the way they communicate can often be impacted by their spirituality. The exemplars for this chapter are hope, which is beliefs, wishes, and actions taken in situations of uncertainty. And certainly our patients feel situations of uncertainty when they've had health crises. Prayer, and there's some specific recommendations on praying with or for clients in your Davis text, page 334. The recommendations are here. I'll let you read those if you want to. It just talks about some very specifics of how to pray with patients or for patients. Sacraments. In healthcare setting, the most oftentimes this interacts with what we do is when patients may request communion or last rites during their stay. And then finally, mindfulness. And this is what Dr. Jean Watson was getting at in her demonstration at that professional nursing conference, was practicing mindfulness, recentering ourselves. One of the things that I took away from that is she said, every time you leave a patient's room, you always have to wash your hands. It's just something we do every single time. And, it's easy just to move on to the next patient and think about the next 5 things you have to do. But she says every time she washes her hands, she just takes a deep breath and she kind of washes away whatever experience she just had with the patient to recenter herself and be able to move on to whatever is next. And it just allows her, again, not to burn out, but to recenter, refuel herself between patient interactions. And I've taken that with me for the last 12 years, and I think it's really beautiful. And I would encourage you to practice mindfulness in your own nursing practice. That's it for the lesson on spirituality. Remember, we treat the mind, the body, and the spirit. We need to make sure that we're treating our own spirits and that we practice presence with our patients. It's one of the best gifts we can give them. Thanks for listening.